All right, hello, my name is Dara and I'm going to be your nursing student. Today, I would like to ask you some questions to gather your health history. This information will help us understand your overall health and provide the best possible care. Before we begin, do I have your permission to ask you these questions?
Yes.
Perfect. All right, so we're going to start with the first questions. All right, so can you tell me your initials and where you live?
DAR, and I live in Scotch Plains, New Jersey.
Perfect. And where were you born and how old are you now?
I was born in Bronx, New York, and I'm 64.
Perfect. How will you describe your gender, identify, or sex?
I am female.
Perfect. All right. And what is your current marital status?
I am divorced.
Okay. And what kind of health insurance coverage do you have?
I have Horizon Blue Cross of Shield.
Perfect. All right. And do you have any advance directive or live-in will? Can you tell me about it if you don't mind?
Not at this time.
Okay. All right. Who's providing most of the information for today's interview?
Myself.
Perfect. And how confident are you of your information that we're about to discuss?
Very confident.
Perfect. All right. Now we're going to move on to your present health questions. So before we begin, it's going to be, how will you describe your overall health right now?
I am in good health. I have some issues with my back, but overall I'm pretty healthy.
Perfect. Alrighty. And when you say overall healthy, like from 1 to 10, how will you describe it?
7.
7? Perfect. Okay. Do you usually go to healthcare when you need it?
I'm sorry, what was that?
So do you usually go to a healthcare, to a doctor if you ever need to go to a doctor?
Yes, it's basically just a physical, just routine checkups. That's about it.
Okay, perfect. And when was the last time you had a complete physical exam and what was it like?
It was in September of 2025, just a month ago.
Okay.
It was fine. Everything came back perfect.
All right. Okay. Can you tell me about any recent tests that you had, like EKGs, X-rays, dentals, eye exams, hearing tests, mammograms?
Yeah, I had one. I had all of that. I had 6 nerve palsy that started in late March of 2025, and because they needed to rule out what was the cause of that, they did CAT scans, MRI, EKGs, everything that you could possibly, X-rays, blood work, everything. So everything came out negative. So the cause of the 6 nerve palsy was determined to be just stress related.
Okay. All right, perfect. So that was good. That was good. Then nothing else. So was it? Okay. What prescription or over-the-counter medications are you taking as right now?
I take only as needed. I prescribe Adderall for my adult ADD. I only take it when I have to. I don't take it on a daily basis. I also have prescription for tizanidine, which is 4 milligrams, and that's for my sciatica and my spinal stenosis pain, as needed only. And I take Tylenol or ibuprofen if I need it, just for, just my sciatic nerve, if it's just that. And then calcium and multivitamins. That's it.
Okay, perfect. And your vitamins, you would say that you also take them like daily or?
I try.
Okay.
I don't always do it, but I try. I do take them. If I miss, I'll just take, it's probably about 4 or 5 times a week.
Okay.
I'll take it.
All right, perfect. Okay, so now we're going to move on to your past history, to your medical history. So can you tell me about any major medical conditions you've had in the past? And if you could remember, like, when the timeline of it?
Well, just recently with the 6 nerve palsy, that lasted, about 4 months. Then prior to that, I just have, for over 20 years, been suffering from sciatica and spinal stenosis, which has been basically the only problem that I have is just that I'm healthy. I don't have diabetes, no high blood pressure, no nothing. That's why I say my health is overall good, fair, very good.
Okay, perfect.
I did have gallbladder removed in 1991. I did suffer from gallbladder disease for a while, but once they removed that, that was taken care of. That's it.
Okay, perfect. All right, so that would pretty much answer my surgical histories. That was the only surgery I've ever had.
Oh, no. I had
there's
more.
more. Okay.
I had cesareans, C-section,
Mm-hmm.
5 of them. I had tonsillectomy. I had lap band in 2008. And then I had it removed in 2020. I think towards the end of 2020, towards 2021, I had it removed, reversed. That's it.
That's it. Okay. Perfect.
Yeah.
All right.
Oh, yeah. I had an ovary. One ovary was removed.
Okay.
Yeah.
And do you remember about also the timeline
That was in
of it?
2012.
Okay. Perfect. Okay. So, and have you ever had any accidents that have happened to you?
Not
any
car
injury?
accidents. I
Okay.
just had I broke my foot with there was a crack in the sidewalk and my foot went one way, so I broke my foot in 2024, last year. It took about 3 months for my foot to heal. That's it.
Okay. So pretty fast recovery.
Mm-hmm.
Good. All right. And do you have any allergies to medications, foods,
Yes.
environment? Yeah.
I'm allergic to morphine.
Oh.
I have my throat gets swollen. I'm allergic to some strawberries if they come from Chile. I break out in hives.
Oh wow. Just specifically from Chile?
Yeah, we've identified them that they come from Chile.
Mm-hmm.
I'm also allergic to mushrooms.
Okay. Also, what do you get it if you
Hives.
Hives as well?
Mhm.
Okay. Okay. All right. Perfect. And then, do you know what kind of blood type you are?
I'm A with Rh factor negative.
Okay. Perfect. And
Which means that when I would be pregnant, they would have to give me the Rogram needle on my thigh.
So you used to get that all the time? All your pregnancies?
At the end of the pregnancy, yes, they would have to give me that needle.
Wow. Have you ever had any blood transfusions?
Yes.
Okay, and how will you how will you describe your experience with them? Did you ever have any?
I didn't see it because I had the blood transfusion when I had my last cesarean for my daughter Kaylee. Being that I was already older, having a child at an older age, and I've had so many previous C-sections, it was a little complicated. I lost a lot of blood during that C-section, so they gave me a blood transfusion.
Okay, perfect. Okay, and so moving on now to just other questions, specifically over your eyes. How will you describe your general conditions for your eyes? Besides
right now,
right
now I'm good.
All right.
Not a few months ago.
Yeah, because of your perfect. Do you wear eyeglasses,
Contacts.
Contact? Okay. Do you know your vision?
Yeah, I'm farsighted.
Okay.
It's plus 350.
Okay.
So it's high.
Yeah.
Pretty high.
All right. And when was the last time that you had your eye exam?
2 years ago.
2 years ago? Okay.
Oh no, that's not true. A regular eye exam 2 years ago, but I just went when I had the 6th nerve palsy. I went to the optometrist and they were checking my eyes, everything.
Okay. Okay. Perfect. Perfect. Okay. And now from your ears, how will you describe your hearing? Your overall hearing?
Horrible. I have what is it? Tinnitus, whatever that ringing in the ear.
Oh, okay. Perfect. Okay. Do you use anything like
Yes.
for, yeah?
I do. I have special hearing devices to cancel out the ringing in the ear.
Oh, okay.
And that's been 2 years that I've had that.
Oh, for 2 years.
Mhm.
Okay. Have you ever had any infections or any ear surgeries or anything?
No.
Okay. Okay, perfect. And then your nose and sinuses. How will you describe your conditions of your nose and your sinuses?
My sinuses are fine.
Okay.
I have seasonal allergies occasionally. It's not a consistent issue. Depends. Some seasons I'm fine. This season I was okay, and but some seasons I think it's more towards like October. I might get some seasonal allergies, but overall, my sinuses and my sense of smell is fine.
Sense of smell. Perfect. Okay. And since you said like you get allergies, do you get like a stuffiness? Do you have like a hard time breathing, or?
No, not the breathing. Yeah, my nose, I get stuffiness. My eyes will be itching.
Okay.
My throat will itch. Yeah,
Okay.
that's about it.
Okay.
My ears are itch, but not severe.
Okay, and you don't pretend like with any pressure or any pain or any drainage when you have allergies or.
No, because when I sense that the allergy's coming on, I take medicine for it right away. I don't wait for it to get complicated, so I tackle it really quick. I take my Zyrtec, I take Flonase, and then I'm good.
And then you're okay. All right,
Mhm.
perfect. All right, and then for your mouth, how will you describe your condition of your mouth and your throat overall? Your taste,
Yeah,
your teeth.
great sense of taste, and smell, everything is fine.
Okay, and then your teeth. When was the last time you went for a dental checkup?
In February,
February.
I went for my routine cleaning. Yeah, see the
Perfect.
dentist.
Okay.
Yeah.
Okay, perfect. And then do you use any source of tobacco or any cigarettes or vaping
No.
or any of that? Okay, perfect. Okay. Now your respiratory system. How will you describe your breathing on a typical day?
That's fine.
Fine.
Yeah.
Okay. Have you ever noticed any changes in your breathing pattern? Or anything
No.
at all? No. Okay. Will you say that you will cough like regularly or just like